Good afternoon, everyone. We are all here assembled for this World Allergy Week 2022. Today's topic is about urticaria. We have a very eminent dermatologist, Dr. Shashidhar Talwar, with amongst us. And we are glad that he is amongst us with his practice. He is having some procedures, so he'll be with us for some time. He practices at the Derma Care, and we at Allergy Center have been treating many allergy diseases. It may be allergic rhinitis, or it may be asthma, or it may be skin-related allergies. Dr. Ajit would can you just go ahead and introduce Dr. Shashidhar Talwar, and then we can start a small presentation by him, and then we can have a small question answer. Thank you.
Good afternoon, everyone. A warm welcome to all. I welcome everyone for attending today's event. Today is day 6 of World Allergy Week. BF Academy is organizing this event. We have two guest speakers, Dr. Puneet Nagendra and Dr. Shashidhar, who will be speaking on a topic called urticaria management. Regarding introduction of Dr. Puneet, he's a chest physician, he's a respiratory physician. He is MBBS from BM Patil Medical College, Vijapur. He did his diploma tuberculosis and chest from SRM Medical College, Chennai. He also had a degree of BMP from National Board, New Delhi. Presently, he is working as associate professor at Daniel Sarwar Medical College. That's Dr. Puneet for you. And we have Dr. Shashidhar, who is a dermatologist and a hair transplant surgeon. He did his MBBS from King's Bangalore. He did his MD dermatology from Medical College, Kolkata. He also has a fellowship in dermatosurgery. He had so many awards in his prestigious career. He got a postgraduate Galderma Award in 2012. He also had received an academic research grant 2013 for study on acne vulgaris in 2014. He's trained under Dr. Manoj Khanna, who is an eminent plastic and hair transplant surgeon. He has worked in various hospitals as a senior consultant and as an assistant professor at Ambedkar Medical College, Bangalore. At present, he is the director of Derma Care Skin and Hair Clinic. That's Dr. Shashidhar Palyu. I thank both of these eminent speakers for attending this event. And over to you, doctors.
Yes, Dr. Shashidhar, welcome you. Can we, do we go ahead and use these slides?
Surely. Thanks for the welcome speech given by doctors. So thanks for inviting me for the first place. So it's a very good program for patients to get to an awareness of urticaria. So it's always nice to interact with the patients in group rather than interacting individually. So we can start the presentation, I think so.
Are you getting the slides, Dr. Shashidhar?
Just a moment.
No, I have already shared. You're mute. Yeah.
Now
you're able to see my slides?
Yes, doctor. I think we can start the presentation. Okay.
Yeah.
So what is urticaria? As we all know, urticaria is a pretty common skin conditions, see which the patient presents with a lot of problems whenever they come to us. They complain of red itchy lesions that result from skin reaction, and also it can vary in different sizes and shapes, and also it repeatedly fades as the reaction runs its course. It is considered chronic whenever it is present more than 6 weeks, and also it occurs frequently over the months of years. So as you can see, these are the urticarial lesions or Hyde's lesions, what we call. So it happens due to multiple reasons, and this is a very classical urticaria lesion which stays for a few minutes to hours and again disappears, and it triggers whenever the triggering agent or the triggering agent is not known. So as I mentioned, the cause of chronic illness is not clear. It can be many reasons. It can be usually because of pain medications, or it can be because of insects or infection or scratching, or it can be heat or cold. It can be due to any stress whenever the person is on excessive exposure to sunlight or severe exercise, or even sometimes taking alcohol or food, or even simple pressure like wearing a waistband or a belt can cause hives. So as you know, hives can occur anywhere in the body. It can happen from head to toe, even in the internal, the mouth, nose, anywhere it can happen. So typically they last for a few days and sometimes few hours also. And the causes being environmental changes, common causes which I'm mentioning, the environmental allergens, the drugs, the stress of the work or personal stress, even the certain particular food because we keep trying the new foods every day. Then systemic illness like sugar or any other chronic illness patient is suffering from, and rarely genetic tendency also can happen. So all these things lead to altered immunity in our body, which leads to hives. So this is very complicated process, but in simple terms, if I have to tell, so whenever an external agent, what we call as an antigen, it can be anything. It can be your food or say new perfume, new dress, whenever comes in contact with our skin or in our body. So there are certain cells, the antigen antibody reaction. What is the antigen being the external agent, antibody being produced internally. This is like as you can see in the picture, immunoglobulin, what we tell. So IgG. So they come in contact when there are excessive production of mast cells, so which leads to this reaction, and because of histamine being released in higher quantities than usual. So whenever the histamines are released high quantity, which is above the normal range, so you get a skin reaction. So that skin reaction occurs in the form of hives. So it can be very uncomfortable and they can interfere with your daily routine activities. In fact, you'll not be able to work or sleep or do anything. So it causes patch of red or skin colored which can appear anywhere in the body, as I mentioned. And most common symptom being itching, which will be very embarrassing also at times. So the signs and symptoms tends to flare, such as heat, excess stress. It can stay more than 6 weeks and unpredictably it can happen at any point of time. Painful swelling can happen to the eye, lips, eyelids, and also sometimes inside the throat also symptoms can happen. As I mentioned, symptoms can be like raised welts with clearly defined border, redness and itchiness, a rash that turns white when it is pressured, when pressure is present. So common antihistamines which are used are loratadine, fexofenadine, cetirizine, and descloratadine, which are commonly given for hives. Other medications which are very important are oral corticosteroids. As we know, steroids are commonly given to suppress the inflammation, such as prednisolone, and certain antidepressants, and off late monoclonal antibodies and immunosuppressants also can be given. Complications are very rare, which can happen due to anaphylaxis. Severe reaction can happen, such as dizziness, trouble breathing, and swelling of lips, eyelids, and tongues also do happen. So human skin conditions which can aggravate are acne, urticaria, pityriasis, bruise, psoriasis, lichen planus, eczema, and fungal infection can present.
Yeah. So now we open the discussion for the patients to have interaction. We thank Dr. Shashidhar to have a small, very precise discussion about urticaria. We can take up very specific questions because urticaria is such a common thing, especially in cities. We come across it. Any questions from the audience, please?
Will they untreated urticaria will lead to psoriasis?
Not necessarily. That's a very good question, I would say. Not necessarily. Psoriasis has a different reasons why it happens, unlike urticaria. But psoriasis patients can have urticaria, but urticaria can never lead to psoriasis, sir.
One thing, is there any internal urticaria? Like if people were telling some throat swellings and all happen, like what is the reason for it?
Yeah, so the thing is that whenever urticaria is very severe, ma'am, so it can be, as I said, urticaria can be due to multiple causes. From the get up till we sleep, anything under the sun can cause. Whenever the allergen quantity is very high, when your body is not able to take, when the intervention is not done immediately, so that time they can have allergy over the especially the face, lip, throat swelling, and also they can have choking very rarely. That's a very rare complication. That's why timely intervention is very important.
So I have a question. This urticaria, you have been saying it is due to many causes. Do you have other system involvement? Is it going to affect the lungs, or it may affect the stomach or nose? I mean,
Yeah, can affect, but it's very rare. Not commonly, doctor.
So when the allergen concentration is very high, then it affects the internal organs.
Yes, you are right.
If
You
it
are
is
right.
skin, okay, then only the skin part is affected.
Yeah, mainly the mucous part, when it is affected, it leads to distress. So, as I said, oral mucosa, throat, or something like that. So that time it can lead to severe allergy.
Sometimes it happens for food also. I have noticed like if we take some food also, we will get like this hives, and later it will reduce again, it will occur. So it happens for food also, right?
Food is one of the most common allergens to cause, ma'am, because as I said, we all have a different immunological systems. So whenever we try anything new, that particular food may not suit you. So it might have high allergens quantity, like example, banana, brinjal. Some people get it very frequently, urticaria or hives to it.
Urticaria continues for a longer time.
So I couldn't.
Yeah, urticaria is a chronic problem. Does it continue for lifetime?
I think not necessarily it can, but again depends on immunological system, sir.
so what we should do when we get an urticaria? Is there any first aid kind of thing
Yeah,
before we go to a
because
doctor?
we need to identify the positive agent. It's very tough to identify normally, but we need to figure out what it is causing. See, generally, as I said, some of the common agents, food agents, when we try, we get it. So try to avoid it as much as possible. If not, you need to take some antihistamines which are commonly available, as we just mentioned, which are there at home, cetirizine or say Allegra, Avil, which are usually at home. So if not, then definitely you need to consult your doctor immediately if it is not subsiding through medicines.
Actually, ನಾನು ಸೇಮ್ ಇದೇ ತರನೇ ಫುಲ್ ಸ್ಪೆಲ್ಲಿಂಗ್ ಆಗಿ ಲೈಕ್ ಹಾಸ್ಪಿಟಲ್ ಅಡ್ಮಿಟ್ ಆಗಿದೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರು ಬಟ್ ಅಗೇನ್ ಆ ಟ್ಯಾಬ್ಲೆಟ್ ಬಿಟ್ಟು ನನಗೆ ಕೋರ್ಸ್ ಅಂತ ಇರುತ್ತಲ್ವಾ 3 days 5 days ತಗೊಳ್ಳಿ ಅಂತ ಹೇಳಿದ್ರು ಆಫ್ಟರ್ ದಟ್ ಅಗೇನ್ ನನಗೆ ತಿರ್ಗಾ ಸ್ಟಾರ್ಟ್ ಆಗ್ತಿದೆ ಅಲರ್ಜಿ ರೆಡ್ಯೂಸ್ ಆಗ್ತಿಲ್ಲ ಲೈಕ್ ನನಗೆ ಇಜಿ ಲೆವೆಲ್ ಬಂದು ಜಾಸ್ತಿ ಇದೆ ಅಂತ ಇನ್ಫಾರ್ಮ್ ಮಾಡಿ ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊಂಡಿದ್ರು ಬ್ರೀತಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಲೈಟ್ ಬ್ರೀತಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿತ್ತು
Clear irrilla nim question, no? Can anyone from the front row repeat the question, please?
Yeah, she has been taking treatment for urticaria. She was hospitalized also. So she wants to know whether how long it will continue or what is the type of treatment that she has to take.
I think Dr. Puneet can answer this question because he's already working such a.
So urticaria is sometimes chronic. We may have to take medicines for long time. It may be maybe 1 month, 3 months, 6 months also. So that is when only during treatment we'll be able to say that certain urticarias are going to take some time. But there are certain other urticarias which will just disappear within 10 or 15 days of treatment. So only upon investigation and evaluation we'll know what is that cause for urticaria. And the treatment is not fixed. It's not fixed.
ಎಷ್ಟು ವರ್ಷ ತಗೊಳ್ತೀವಿ?
ಈಗ just 3 to 4 months heavy ಆಗಿದೆ.
She has reversed her reaction.
3-4 months.
Okay, if we do not have any further questions, just Dr. Ajit, would you like to just or Amarnath sir, can
Yes.
you just conclude it? Yeah.
Yeah. I have got the questions here.
ಒಬ್ಬರಿಂದೊಬ್ಬರಿಗೆ ಸ್ಪ್ರೆಡ್ ಆಗೋ ಚಾನ್ಸಸ್
Yes, sir.
ಅದಕ್ಕೆ ಲೈಕ್
ಸ್ವಲ್ಪ ಜೋರು ಮಾತಾಡಿ.
ಕನ್ನಡದಲ್ಲಿ ಜೋರಾಗಿ ಹೇಳ್ತಾರೆ. ಅವ್ರ ಕನ್ನಡ
ಅದು ಒಬ್ಬರಿಂದೊಬ್ಬರಿಗೆ ಸ್ಪ್ರೆಡ್ ಆಗುತ್ತಾ ಅಥವಾ ಸಪೋಸ್ ಫುಡ್ ಇಂದ ಬಂದಿದೆ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಬಾಯಿ ಹುಣ್ಣಾಗಿರುತ್ತೆ ಸೊ ಅದು ಒಬ್ಬರಿಂದೊಬ್ಬರಿಗೆ ಸ್ಪ್ರೆಡ್ ಆಗುತ್ತಾ
ಕಂಟೇಜಿಯಸ್ ಅಂತ ಕೇಳ್ತಾ ಇದ್ದಾರೆ.
It is not, as I said, it's immunological system disorder. ಇದು ಬಾಡಿ ಒಳಗಡೆಯಿಂದ ಬರೋ ಕಾರಣ ಸೊ ಅವ್ರು ಇಬ್ರು ಒಬ್ಬರಿಂದ ಒಬ್ಬರಿಗೆ ಹರಡಲ್ಲ. ಇದು ಇನ್ಫೆಕ್ಷನ್ ಅಲ್ಲ. ಇದು
ಸಪೋಸ್ ಹೊರಗಿನಿಂದ ಏನಾರೋ ಆಂಟಿಜೆನ್ ಇಂದನೋ ಆಗಿದ್ದಿದ್ರೆ
ಇನ್ನ ಕೆಲವು ಸರಿ ಧೂಳು ಆಗುತ್ತೆ, ಕೆಲವು ಸತಿ ಊಟ ಯಾವ್ದೋ ಒಂದು ಬಾಳೆಹಣ್ಣು ತಿಂದ್ರೆ ಕೆಲವು ತೊಂದ್ರೆ ಬರುತ್ತೆ. ಅದ್ರ ಆಮೇಲೆ ಸ್ವಲ್ಪ ಹೊತ್ತು ತಿರ್ಗಾ ಹೋಗುತ್ತೆ.
ಹೇಳಿ ಸರ್, ಇನ್ನೇನಾದ್ರು
ಫುಡ್ ಇಂದ ಬಿಟ್ಟು ಬೇರೆಯಿಂದ ಏನಾರೋ ಲೈಕ್ ಹೊರಗಿಂದ ಏನಾರ ಆಂಟಿಜೆನ್ ಇಂದ ಅಂತ ಹೇಳಿದ್ರಲ್ಲ ಅದರಿಂದ ಆದ್ರೂ ಯಾವ್ದ್ರಿಂದ ಬಂದ್ರು ಇದು ಒಬ್ಬರಿಂದ ಒಬ್ಬರಿಗೆ ಲೈಕ್ ಕಂಟಿನ್ಯೂ ಆಗಲ್ಲ.
ಇದು ಬಾಡಿ ಇಮ್ಯುನಾಲಜಿಕಲ್ ಸಿಸ್ಟಮ್ ಡಿಸಾರ್ಡರ್ ಅಲ್ವಾ. ಒಬ್ರದ್ದು ಇಮ್ಯುನಿಟಿ ಇನ್ನೊಬ್ರ ತರ ಇರಲ್ಲ. ಸೊ ಒಬ್ರಿಗೆ ಬಂದ್ರೆ ಇನ್ನೊಬ್ರಿಗೆ ಬರ್ಲೇಬೇಕಂತಿಲ್ಲ. ಬಟ್ ಅವ್ರಿಗೂ ಏನಾದ್ರು ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಒಳಗಡೆಯಿಂದ ಬರಬಹುದು, ಬರ್ಲೇಬೇಕಂತ ಇಲ್ಲ.
Like psoriasis ಹೇಳಿದ್ರಲ್ಲ, psoriasis is a curable one. Psoriasis disease ಕ್ಯೂರ್ ಆಗುತ್ತಾ?
ಇದು ಆಟೋಇಮ್ಯೂನ್ ಡಿಸಾರ್ಡರ್ ಅಲ್ವಾ. ಆಟೋಇಮ್ಯೂನ್ ಡಿಸಾರ್ಡರ್ ಅಂದ್ರೆ ದೇರ್ ಆರ್ ಮಲ್ಟಿಪಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್. ಸೊ ವಿ ಹ್ಯಾವ್ ಟು ಟ್ರೀಟ್ ದ ಕಂಡೀಷನ್ ಅಕಾರ್ಡಿಂಗ್ಲಿ. ಯಾವ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಅದು ನೋಡ್ಕೊಂಡು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕು.
ಲೈಕ್ ಇಬ್ರು 2 ಪೇಷಂಟ್ಸ್ ನೋಡಿದೀನಿ. ಲೈಕ್ ಒಬ್ರು ಅರೌಂಡ್ 50 ಪ್ಲಸ್ ಇದಾರೆ, ಇನ್ನೊಬ್ರು ಲೈಕ್ 20 ಪ್ಲಸ್. ಬಟ್ ಅರೌಂಡ್ 50 ಪ್ಲಸ್ ಇರೋರು ಆಲ್ಮೋಸ್ಟ್ ತುಂಬಾ ಕಡೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ತಗೊಂಡಿದ್ದಾರೆ, ಎಲ್ಲ ಏನೂ ಆಗಿಲ್ಲ. ಲೈಕ್ 20 ಪ್ಲಸ್ ಇರೋರು ಈಗ ಅರೌಂಡ್ 10 ಇಯರ್ಸ್ ಇಂದ ಸೋರಿಯಾಸಿಸ್ ಅಂತ ಆಯುರ್ವೇದಿಕ್ ಮತ್ತೆ ಇವನ್ ಲೈಕ್ ಇಂಗ್ಲಿಷ್ ಅದೆಲ್ಲ ತಗೊಂಡಿದ್ದಾರೆ, ಅಲೋಪತಿ ಎಲ್ಲ ತಗೊಂಡಿದ್ದಾರೆ. ಬಟ್ ಆದ್ರೂ ಏನು ಲೈಕ್ ತಗೊಂಡಾಗ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಅನ್ಸುತ್ತೆ, ಬಟ್ ನಾಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ಕ್ಯೂರ್ ಆಗಿಲ್ಲ.
ಇದು ಆಟೋಇಮ್ಯೂನ್ ಡಿಸಾರ್ಡರ್ ಅಲ್ವಾ. ಆಟೋಇಮ್ಯೂನ್ ಡಿಸಾರ್ಡರ್ ಅಂದ್ರೆ ಅಗೇನ್ ನಿಮ್ ಬಾಡಿಯಲ್ಲಿ ಸೆಲ್ಸ್ ನಿಮ್ ಸ್ಕಿನ್ ಸೆಲ್ಸ್ ಬರುತ್ತೆ. ಸೊ ಆ ಸೆಲ್ಸ್ ನ ಸರ್ಟನ್ ಎಕ್ಸ್ಟೆಂಟ್ ಸಪ್ರೆಸ್ ಮಾಡ್ಬೋದು, ಕಂಪ್ಲೀಟ್ ಆಗಿ ತೆಗಿಲಿಕ್ಕೆ ಆಗಲ್ಲ ಬಾಡಿಯಿಂದ.
ಸೆಲ್ಸ್ ಸೆಲ್ಫ್ ಮಲ್ಟಿಪಲ್ಸ್ ಆಗ್ತಾ ಇರುತ್ತೆ.
ಹಾ ಕರೆಕ್ಟ್, ಕೈಂಡ್ ಆಫ್ ಸೆಲ್ಸ್ ಸ್ಕಿನ್ ಮೇಲೆ ಆಗುತ್ತೆ.
So we can only like avoid but
we can only control it. We can only control it. We cannot cure it.
Oh, lifetime
ಡಿಪೆಂಡ್ಸ್ ಅಗೇನ್ ಬಾಡಿ ಹೆಂಗಿರುತ್ತೆ ಅದ್ರ ಮೇಲೆ. ಕೆಲವರಿಗೆಲ್ಲ ಒನ್ ಟೈಮ್ ಅಂದ್ರೆ ಬರಲ್ಲ, ಕೆಲವ್ರಿಗೆ ಮತ್ತೆ ಮತ್ತೆ ಬರುತ್ತೆ. ಸೊ ಎವ್ರಿ ಬಾಡಿ ಇಸ್ ಡಿಫ್ರೆಂಟ್ ಅಲ್ಲ. ವಿ ಕ್ಯಾನಾಟ್ ಜನರಲೈಸ್. ವಿ ಆರ್ ನಾಟ್ ಲೈಕ್ ಮಿಷನ್. ಸೊ ಎವ್ರಿ ಬಾಡಿ ಇಸ್ ಡಿಫ್ರೆಂಟ್. ಒಬ್ಬರಿಗೆ ಬಂದ್ರೆ ಮತ್ತೆ ಪುನಃ ಬರೋದಿಲ್ಲ, ಕೆಲವರಿಗೆ ಮತ್ತೆ ಬಂದ್ರೆ ಮತ್ತೆ ಬರ್ತಾನೆ.
Thank you, doctors. In the shortest time that is given, you explained most of the things. You addressed many of the issues, though it is all it requires more time. However, we thank you for giving us your valuable time. Dr. Sheshidhar Talwar, we especially thank you, sir, for joining this meeting and addressing us. Thank you, sir. Thank you, Dr. Puneet Pomarla also. We all enjoyed, we all clarified so many doubts.
Thank you everyone for
Thank you,
giving.
sir. Thank you. Yeah. Thank you, Dr. Shashidhar.
Thank you, doctor.
Thank you. Bye bye.